Hi there YSI Global, my name is Keaton Harris and I am a 22-year-old applicant from South Africa for the 2018 intake. This video will be giving you a brief representation of the system that I have devised, which will hopefully aid in the streamlining of public healthcare facilities in developing countries.
So the reason why I want to change the system is due to the following reasons. Patient waiting time is on average 8 to 11 hours, unless one is on the verge of dying and without immediate treatment will demise. They sit in rows according to who got there first, queuing since 4 a.m. to make sure they are out of the facility by 5 p.m. There is an increased patient waiting time, which means there is an increased chance of nosocomial infections, in essence, infections obtained within a hospital. Some of the most common infections being nausea, vomiting, and gastroenteritis, which can cause dehydration if not treated. This is yet another preventable complication. There is an increased patient-to-doctor ratio as patients who are initially accompanying a friend, family member, or child are presenting to the hospital as a patient with individualistic symptoms. This further increases the susceptibility of tuberculosis infection as it is communicable, thus negating the culminated effort of minimizing the impact of burden of disease in South Africa, as indicated by the World Health Organization. Patients who are present for chronic follow-up and are immunocompromised are at a heightened risk for developing diseases. This prolongs treatment for them, complicating their current prognosis. This increases the amount of medicaments they need to take, as well as decreases the chance of the patient remaining 100% competent and compliant to their treatment regimen. There is therefore an increased need for monetary compensation by the government to maintain the demand for healthcare, as preventable diseases are now needing treatment. This takes away from the time and money that could have been better allocated towards treating both high-risk and low-risk patients who present to the hospital as initial cases. In essence, they did not become sick due to being in a hospital setting as an acquaintance. I could go on forever regarding the problems that prolonged waiting times have on both the immediate and future health of patients, but I only have 2 minutes. My breakthrough solution is the division of patients as per color-coded triaging, including the limiting of patient feet, so those who visit the public healthcare facility, through decreasing their hospital stay, promoting adequate hydration practices, and ultimately decreasing spontaneous mortality of patients, which could have been prevented had they been seen earlier. Through allocating qualified doctors in the high-severity areas, examples blue which require immediate attention or resuscitation, red for really severe conditions, and orange for moderately severe conditions, and allocating both nurses and medical students to the other areas, which is yellow for acutely severe and green for not that severe, we are creating an environment where there is constant patient flow. Through incorporating this with the sugar-salt dispensing system in the waiting rooms, patients will be able to mix their own fluids for electrolyte replenishment. This will ensure that there are less cases of dehydration and death of children in hospitals, as it is the third leading cause of death at public hospitals in South Africa. The instructions will be diagrammatically represented along with interpretations in all 11 languages of South Africa for maximal compliance. This can therefore be adapted towards the language base of other developing countries. Here, through the incorporation of the cellular language application I have developed, as mentioned in my Part 2 application, to break language barriers in developing countries, there will be a decreased contact time between the doctor and patient, which will further be able to strengthen the outcomes of my alteration. Doctors who are finished with treating those in the red triage bay and have no patients in their specific color-coded waiting area will then be able to move towards the next most serious category and assist with those patients. This ensures patients are managed according to their condition severity, ensuring that minimal external factors influence their quality of life and the ability to provide for others, allowing them to create that foundation of success. Money is also saved as the demand for treatment is decreased, allowing for monetary allocations to be made towards more feasible areas within healthcare. I would also like to work with Xyla Waterworks, as I believe that their project would be of great use in developing countries, especially as water is needed for the creation of the oral rehydrate solutions. This may seem like a small alteration, but it usually those that dare to challenge the small issues that are able to make the largest impact. It is through this system that change with regarding to numerous UN SDGs will be simultaneously achieved. Thank you so much for your time, and I genuinely hope I will be able to be working with you all this year.